Hello and welcome to iTenif Healthcare Solutions webinar. We're excited to present ChartGuard for NextGen. My name is Chelsea Grover and I'm the Marketing Communications Coordinator for iTenif. I'd like to take a moment to explain the process for today's presentation. First, I'd like to mention that this webinar will be recorded and that we'll send out a copy of the slides along with the recording within the next week. Now, as most of you know, this is usually when we cover a bit of who we are with you, but since I promised in the webinar invitation to make this one brief, we're just going to jump straight into it. And as an FYI, everyone's phone will remain muted throughout the entire time. Please use the webinar control panel to ask any and all questions. We'll answer them all at the end, but you can ask them anytime. So, I'm going to go ahead and pass the presentation off to our presenters for today. Tom Seco is iTenif's Business Development Manager and subject matter expert on the products. And Joe Schultz is Director of Product Solutions at iTenif, which means that he and his team are the people that actually built ChartGuard and thus is going to be in a great position to demonstrate it. So Tom, I'm going to pass it off to you. Feel free to get started when you're ready.
Okay, thank you very much, Chelsea, and thank you everyone for joining us on our webinar today to learn more about accessing your patient records during an unexpected system outage. As an agenda, what we're going to cover today, you'll gain an understanding of why practices invest in this type of solution. We'll talk about EHR dependencies and what that is. We'll go through how ChartGuard works, and we'll show you the output that's generated by ChartGuard, and then we'll answer any questions that you may have. So what we're talking about today is unplanned downtime and how to be prepared for it. A survey was conducted by U.S. healthcare organizations that stated in the previous 3 years, 96% of the institutions reported at least one unplanned downtime situation, and 70% had at least one unplanned downtime that's lasting 8 hours or more. So simply what we're talking about today is a business continuity solution that ensures that you have the availability of your patient charts during an EHR downtime. So a little bit about the dependencies and the impact of downtime on those dependencies. We all know that our EHR systems are based on complex technology. So we have servers, we have workstations, we have tablets, we have scanners, we have local area networks, we have T1 lines, fiber lines, VPNs, wireless routers, wireless base stations, internet connections, cooling systems, power systems, and behind each one of these components, there's software that's running each one of them as well. So any one of these components can go down, and when you have one of these components that go out and are no longer useful or using it, you have an impact of a downtime situation. So what does that mean to us? That means that we could have, quality of care can be impacted, lost productivity can be impacted, lost revenue could occur as well, and so it does have quite an impact on the organization when you lose access to your systems, EHR systems. Because we become so dependent on our technology and it nearly works all the time for us, we tend to put how outages occur in the back of our mind and not really think about it. So what can cause us to have an issue with any one of these components that I just talked about in a previous slide? So if you take a look at this slide here, it shows you the types of outages that can occur and how they impact an organization as well. I've done some research over the years, and this is some of the internet outages that have occurred and why they occur. So you see, the date that it occurred, who had the outage, what was the cause of the outage, what was the effect, the duration, and the type of outage that happened. So you'll see that there's situations that are caused by humans, where we have humans who make mistakes with good intentions, but make a mistake, and we have humans who are there to create disruption and chaos. We have outages that are computer-based, we have outages that are software-based outages, and we have outages that are caused because of nature, because of storms and things like that. So there have been some studies that have been done over the years with regards to downtime and what it costs an organization, a healthcare organization. Some of those studies have shown that it can cost as much as $488 per hour per provider, so it can be quite costly. If you extrapolate that out, a 10 provider practice that's down for 4 hours can cost as much as $19,520. So the cost can escalate pretty quickly when you're down. Because we have situations that affect our EHR systems, HIPAA has a clause that says we should have a contingency plan or plans in place when responding to various emergencies or other situations that can impact our EHR systems. So what are our options if we have a downtime situation? We could temporarily close the practice or close the location. We could implement fully redundant technologies, so we could implement additional servers, we could implement additional networks, add another data center, add another power system, add another cooling system. So we could add more redundant technologies like that. We could go to a hosting environment, but if you really think about hosting, if most outages occur because of lost internet connection, so if you lose your internet connection, you can't get out to your hosted site. Go to paper charts, but that's becoming more and more difficult for us to do because we're becoming so dependent on our EHR systems. And we could implement a solution that ensures that you're prepared to handle downtime situations. That would be another option that would be available to you. So as as we reflect on just what I talked about, that our systems are complex, that our systems are dependent on many components, that downtime is caused by unexpected events which are beyond our control. And then we talked about what our options are with regards to a downtime situation. Some of the questions that we should be asking ourselves and thinking about are just these that are up on the screen here. So we should be asking a question, when we experience an unexpected downtime situation, who would be the first to notice there is no access to NextGen? Would it be our physicians? Would it be our providers? Would it be the front office? Would it be the back office? Who would be the first to notice that there's no access to NextGen? Another question I'd be asking is, do I pursue uptime or do I pursue a solution that enables me to continue on with my business until NextGen comes back online? So do I pursue uptime, meaning do I put more money towards redundancy of servers or redundancy of cooling systems or backup systems or internet connections? Do I spend more money there or do I spend more money someplace else? What are the types of impacts that a NextGen downtime incident can have on our clinic? Those impacts that I talked about with regards to impact on revenue, what would be the impact on productivity? Would there be an impact on quality of care? So understanding what those types of impacts would be to our clinic and our health center. And then how significant can the impact be to our clinic based on the duration of the downtime incident? Meaning, if I'm down for 1 hour, what would be that downtime impact to productivity? What would be that impact to revenue? What would be the impact to quality of care? If I'm down for 2 hours, what would that impact be to revenue and to productivity and to quality of care? If I'm down for 3 hours, what would be that impact to revenue, to productivity, and to quality of care? If I'm down for 4 hours, so kind of go through that sequence and analyze what that impact would be to the organization. And then am I going to be proactive or reactive in my clinic's preparedness for downtime? Meaning, I've had a downtime situation before and I experienced it. It had an impact on our organization, so I want to be reactive in implementing a solution that's going to enable me to be prepared for another time when a downtime incident occurs. Or I'm going to be proactive, meaning I haven't experienced a downtime situation, but I want to be prepared because I know it may happen in the future. So I want to be prepared for a downtime situation. When was the last time that we reviewed our downtime preparedness and business continuity strategy and plan? So if it was within the past year, if it was in the past 3 years or 4 years or 5 years, or I did it once and I never went back to review it. So ask those questions as well. And then how do I minimize the loss, and how do I minimize the disruption when a downtime situation does occur? That's the question that you should be asking as well. So I know I'm going to have a downtime situation that's unplanned, that's unexpected. How do I minimize the disruption to the office, to the clinic, to the location, to the practice overall? How do I minimize the loss? How do I minimize the impact on revenue? How do I minimize the impact on productivity? How do I minimize the impact on quality of care? So these are some of the questions that you should be asking as you're thinking about being prepared for a downtime situation. And the question shouldn't be, am I going to have a downtime situation, or am I going to experience it? As we saw in the previous slide that I showed with regards to all the outages that have occurred over a period of time, and they can happen, for any various cause or reason, you need to be prepared for a situation that it is going to happen. So the solution, as we talked to some of our clients in the past, who came to us and said, we want to be prepared for a downtime situation. Can you come up with a solution for us? So we came up with our ChartGuard solution. It's an affordable business continuity solution that is cost effective, easy to use, and ensures that you're prepared for a downtime situation at each of your office locations or clinic locations, and that you will have access to your patient charts during an EHR downtime situation. So what I'm going to do now, I'm going to turn it over to Joe Scholes, and he's going to talk you through how our ChartGuard solution works.
Great, thank you, Tom, and thank you for our attendees today for taking time out of your schedule. ChartGuard was designed a little different than most other continuity solutions in that we want you to have the data at your locations when the outage occurs, and this is an important differentiator. When we worked with clients to create ChartGuard a little over a decade ago, they were in areas subject to extreme weather events like hurricanes, tornadoes, big thunderstorms. And we decided, you know what, putting this data in the cloud wouldn't help, because normally in an outage, the most common outage is your network, right? Tom showed you that slide earlier, and that was one of the big common denominators across those outages is having your network goes down. So if your EHR data is backed up to the cloud, it does no good if you can't get out to the internet to begin with. So what ChartGuard does is it runs every night and extracts data out of your NextGen EHR, creates PDF files that represent basically the paper charts we had, a number of years ago, and copies the appropriate charts to the location where the patient is scheduled. You designate a computer at each of those locations that'll receive the charts, and each morning it's updated with a set of charts for the patients coming in over the next few days. Now, that day period is tunable. We normally pick 2 or 3 days just because sometimes you get an outage late in the day and that outage goes into the next day. Sometimes you have maintenance going on overnight and that bleeds into the next morning. So this gives you the opportunity to have that clinical information out there in easy to read PDF files that can be opened on any device and be prepared for those times when you can't get to your NextGen EHR. So again, there's a service that runs centrally. It has all the brains in it. It'll produce these PDF files. It copies them out to each location based on the patient appointment. And then at each location, it's simply a PDF file that you can search for within the secure folder and open up. Now, obviously, we have recommendations for how to set up those machines and how to secure them that are going to receive the charts. But the good news is, unless you want to, we don't accumulate patient data out there. So if you say you want to keep 3 days worth of appointments, those charts on those machines at those locations, we will continuously move that 3-day window. So we'll purge the old stuff and add the new stuff so that you only have a few days worth of data at each of those locations. So it helps manage your EPHI also, and it helps keep the computers at each of those locations from filling up and running out of disk space, which obviously we don't want, because then you wouldn't be able to get your charts. So we worked with a number of clients over the years to refine this process, and what we have today has been useful to quite a number of small and large practices, because if you're small and have a single location, if that one location's down, right, that's your whole practice. But if you're large and you have a number of locations, then that increases the odds of any one location being down on any given week. So what's in these charts that we create? What's in these PDF files? Well, Tom will take you through that in just a minute, but out of the box, you're going to get a baseline chart, and that's normally where we start, and then we can work with you to tune it for your specific needs and specialties. In addition to the chart, you're going to get a daily appointment listing, because it's useful to still know when the patients are coming into the practice. And if you're dropping these charts to paper, then you can drop them based on the timing of the patients coming in, right? If you have a whole day's worth of charts, you don't want to print them all to paper when the network's going to be up in an hour. So that way you can just kind of print them on demand as the day goes along. Now you also have the option to use the PDFs electronically if the network within the four walls of that building is still operational. Great thing about PDF files, right? Every device can access them, and they can be easily printed or easily read. So in the chart itself, you're going to get a patient data sheet, which has great things like the demographic, the guarantor, the insurances. You're going to get your NextGen module data. So we have it listed here, right? Allergies, immunizations, labs, orders. We'll work with you to filter the depth of that. So if the patient's been coming to your clinic and you've been in NextGen for 15 years, you probably don't need all 15 years worth of that data. So the key is to keep the chart somewhat compact and relevant. This isn't a clinical history record. This is the data you typically need during an outage. And the more we can work with you on kind of scoping that, the easier it'll be to print this information and use it electronically. We also pull in documents, and those documents can be from ICS/Document Manager. So it could be things that you scan in or come in from another system that you deem as relevant during an outage. It can also be your EHR documents, which are really the snapshots of your template data. So if you're producing those documents, or you have custom templates that produce those documents, you can go ahead and capture that into these PDF files. So you're going to get your appointment listing, and you're going to get a PDF file for each patient that goes to each location where the patient is scheduled to present. And again, we already touched a little bit about the customization. We can work with you on the number of days worth of patients looking forward in your schedule to generate each night. And we can go ahead and set the amount of data that's going to be in these PDF files. Again, it's not a full clinical history that we're looking for. It's just your downtime information. As a quick aside, we do have ChartGuard On Demand, which is a tool that you can use to generate full clinical histories for people if you have patients requesting them, insurance audits, or providers coming and going, and you want to give the providers their patient's history. But for ChartGuard, as we're talking today, for continuity, we're really looking to give you that information to be used during downtime. It's NextGen KBM agnostic, so that it works with multiple versions of KBM and can be customized along with the appointment listing. For example, if you need more details in there from the details field, we can go ahead and tweak that. Or if you're using a user-defined field as collecting some data that's critical for the appointment coming up, we can go ahead and customize that too. So I'm going to turn it back to Tom, who will take you through what the PDFs actually look like.
Okay, thank you, Joe. So let me show you what the PDFs look like. This is an example of the appointment listing and what it looks like. So you have the location, you have the provider, you have the date and time of the appointment, the patient that's coming in and what they're coming in for. So the front desk will know who's coming in and who they're coming in to see and what they're coming in for. So that's provided to you as Joe mentioned in the one of the PDF files that gets generated by ChartGuard. And then let me show you what the chart looks like. This is what the patient chart looks like. That gets generated by ChartGuard. As you see here, here's the demographic information. And then as we scroll down, you have the responsible party, the primary insurance, secondary insurance information. And then we get into the module data. So here's the allergy information. As you see, it's on a nice table format. And as Joe mentioned, you can control the scope of this information as well, meaning you can determine how far you want to go back in terms of calendar time or how many instances of something that you want to show. Here's the active medications. And scroll down further, here's the labs. Again, you can control, give me all the labs within the past 6 months, or give me the past 4 labs. There's chronic conditions. So you can scroll from top to bottom to get to the section that you want. But we also bookmarked each section as well. So if you come over here at the bookmark on the left-hand side and click the bookmark, you then have all the bookmarks shown to you. So you can just click on that particular section that you want to see, and it'll take you right there. So if you want to come back down to immunizations, you can take a look at that. If you wanted to take a look at vital signs, you can click there. If you want to go back to chronic conditions, you can go there. So you can scroll from top to bottom if you desire, or you can come over here to the bookmarks and take a look at those. And then as you scroll down, here's the social history, but we can go directly to the documents. Here's the documents that Joe mentioned that we bring in, and this is what they look like. And then ICS images as well. So we can bring in the images from the ICS database. So that's what the patient chart that's generated by ChartGuard looks like as well. The appointment listing gets generated, so the front desk knows who's coming in and what they're coming in for. The patient chart here is there to make sure that the provider can continue to see their patient with minimal disruption and not have to ask question after question as to what the patient is, because the information's here in their chart and they can quickly take a look at it and continue to see their patients with minimal disruption. Oops. So we had a client of ours who took the time to write us an email about their experience with ChartGuard. This was an orthopedic practice in Tennessee, and they're a fairly large practice now. They're about 20 locations, and they've been using ChartGuard for several years. After they purchased ChartGuard, it was implemented in June, and about 6 months later, in December, they experienced an outage at their 2 largest clinic locations. And prior to implementing ChartGuard, they typically closed the clinics that were affected by an outage and had to turn away their patients. With ChartGuard being implemented, they were able to see their patients with minimal disruption using the appointment listing and the PDF charts that were generated by ChartGuard. And so they were able to keep the clinical side of the practice functioning while their IT team was working to bring NextGen back online. And as you can see from the quote here, their physicians were quite pleased with the ChartGuard solution. So with regards to next steps, if you'd like to have a more in-depth discussion about ChartGuard and how it would work within your practice or your health center, my contact information is here on the screen, as well as Joe's information here as well. This way you could ask questions as it specifically pertains to your organization and to your current processes. And with that, we'll answer any questions that you have.
Great, thank you so much, Tom. Thank you, Joe. And again, thank you everybody for joining us today. If you have questions, feel free to type them in the questions area of the webinar control panel. We only have a handful, so we're gonna have plenty of time to get through them. If you think of any while we go through them, feel free to type them in. So in the order that they came in, Joe, it looks like this one's gonna be for you. We're an OB practice. Is it possible to get our OB patient charts backed up outside of the 3-day appointment window?
Yes, it is. We've worked with other OB practices, and what we've done is we've looked for either indicators in the EHR that says the individual is pregnant, or some diagnosis out there of pregnancy. And for those ones, we'll go ahead and generate those charts every night. And then, we'll still capture the 3 days of upcoming appointments. So that way, if someone does go into labor and they didn't have an appointment coming up, you'd still have that chart out there.
Perfect. Thank you, Joe. Next question. How do we securely secure these patient charts so that unauthorized people can't access them?
I'll go ahead and take that one too. We have some guidelines we give you for setting up the computers that are going to receive the charts at each location. Most computers nowadays that practices are deploying have hardware encryption turned on the hard drive, so we want the encryption on. It can be Microsoft BitLocker or some other solution. We also recommend locking down the access to those folders, so again, only the people who should have access have access. And then the last piece of the basics is to turn on Windows file system auditing so that if someone does access the chart on that machine, if you're using them electronically within the network during downtime, then that'll be audited in the event log on that computer. So those are kind of several starting points, and then we'll work with you and your IT staff to design anything that's needed for your specific compliance.
Thanks, Joe. And it looks like this may be our last question. Do we have to choose between printing or viewing on a tablet, or can we do both?
You can certainly do both. We have clients, by default, they set up to print. The machine that has the charts loaded on them each night from ChartGuard also has a directly attached printer. So worst case, if the network is down, they can go ahead and print to that printer that it may be on the network when the network's up, but it also has like a USB cable connecting it to the PC. Now, should the network stay up, you can then share that folder to the appropriate people. Some clients set up a shortcut on their clinicians' desktops, and then they'll just click on that, get to the folder, and use the search in the upper right of the Explorer to pull up the patient chart and open it. So there's, a number of different options based on the type of outage you're having.
Okay, perfect. Well, it looks like that's all the questions that we have, but if you think of any others or if you are too embarrassed to ask them out loud, you see both Tom and Joe's information up on the screen. Feel free to reach out to them directly. You can also always reply back to the email that I'll be sending in the next few days here with a link to the slides and recording. Basically, any way that you can get a hold of us, we're happy to help. That's why we're here, so don't hesitate to reach out to us with any questions at all. And thank you everyone for joining us today. I hope you have a great rest of your week and enjoy the rest of your day.
Thank you, everyone.
Thank you, everyone.